Hey everyone, it's your girl Nice Diaries and I'm back with another video. So let's keep watching to find out what this video is about, what's going on, etc. This week I thought, why not speak to you guys about what I've done recently, what I've been up to. And I know that I kept telling you guys that I wanted to do something to put myself out of my comfort zone. I think I said that on Instagram. So I thought, why not share with you guys the experience I had working. Those that don't know, I work on a gynecology ward, but we do work closely with the clinics, and I've always wanted to find out what it is that they do, but I've never worked in the clinic because I'm not a clinic nurse, I'm a ward nurse. So I asked if it was possible to spend the day in one of the clinics and then to spend another day in outpatient. So I finally managed to do that, and I'm gonna literally explain to you guys what it was about, how it was, and what they do in those departments, because I feel like it's actually quite important for you guys to understand. And if you feel like that's something that you want to do, at least now you have an idea of how it's actually like. So the first day I worked in the emergency gynecology unit. So with that department, it is a clinic, and what happens is that they get referrals from GPs, or they get referrals overnight, and they usually triage these referrals, see if they're appropriate for these ladies to be seen and scanned. So majority of the time these ladies are pregnant, and they're coming in because they're seeing something like abnormal with their pregnancy, for example PV bleeding, and they just need a scan. So you've got a clinical nurse specialist that scans the ladies and sees how far the pregnancy is, if it's a normal pregnancy, if it's an ectopic pregnancy, if it's a miscarriage, and they implement plans that are put in place. Sometimes with not all miscarriages you need to take medication or have surgery. Some can actually be done at home or go naturally. Others require medication to be taken, which the ladies are asked whether or not they feel comfortable doing it at home, or whether they want to be admitted to the ward to do it. And others opt for the surgical route. And there's also something called MVA, which is manual vacuum aspiration, which is another way of also completing the procedure. So yeah, that was really interesting. It's actually really interesting to even see a nurse scan, and I was just really amazed by all the knowledge that these nurses do know. Being able to scan is a skill within itself, and the person that I was shadowing was teaching me different room shapes, which I never even knew that there was different room shapes. I thought everyone's room was the same, but no, there's different shapes of the room, which is something really interesting that I didn't know. I feel like if you do midwifery, then you would love it, because it is kind of midwifery as well, in the sense where you're scanning people. But with me as a nurse, especially nursing school, we never got taught stuff to do room shapes, etc., because we were focusing more on other aspects of nursing. So yeah, that was really interesting, and I just feel like it was nice being able to watch them do their own thing, but be really confident with what they're doing, and also having a doctor there present if you have any questions. And that's what I like to see as well, because I feel like at any stage, if you feel uncomfortable asking, doing something, or if you're not sure about something, at least there's somebody that you can always go back to ask for help or support or second opinion, which is really interesting. So yeah, that was a really good day. So the clinics are usually from 9 to 5, but this clinic starts a bit earlier. I got there at 8. So they start a bit earlier just so that they can look at their emails, set referrals, and telephone, see whatever phone calls were kept, so that they can triage these patients as well. And everyone does something else. So there's some people that are scanning, there's some people that are answering calls. So yeah, it is interesting. Yeah, I really did enjoy the day in emergency gynae unit. I feel like it's something that I didn't know I would actually enjoy that much until I actually managed to go there. And I did get taught a lot. I was able to ask questions that I've always actually wanted to ask, but I never really had the opportunity to ask, and try and understand more. I like how there's so many different protocols that needs to be covered, and to ensure that these patients are getting the right care, and like if something happens, or if a lady's spoken about bleeding, etc., just to double check and confirm that they're not pregnant. We do a HCG test, and even being taught how to follow the HCG levels, to ensure that it's going down. I don't know, like I've learned so much, and I wrote down so much information just so that I can actually go back and look at it and refresh my memory with everything that I learned, because in a day to retain all that information is quite a lot. But honestly, I really did enjoy that day. So that was the first day of me working somewhere else than my usual wards. The second day, I went to the gynae outpatient department. So on this day, I started the day off with going to the gynecology oncology multidisciplinary team meeting, and that was so interesting. I feel like I never even knew that they had such a massive MDT meeting until that day. And it was so, yeah, it was really interesting. So I was with the gynecology oncology nurse specialists, and I was also with the consultants. So those were the people that were in the room, and the coordinator as well. And then the call was done with other like consultants and clinical nurse specialists who were online, and it was really interesting, like going through like the plans of gynecology oncology patients, not only in our hospital but in other hospitals as well, going through their plans, ensuring that the right care is put in place, and making sure that if anyone else has any different suggestions as to their treatment and care plans is done, and their diagnosis as well. So it was really interesting, and I learned so much only through that one day of being there. Yeah, it was really interesting. It's something that I feel like every ward nurse should definitely do, because honestly, you just learn a lot. There's so many new words that I had to just write down because I had never heard of it before. So it's definitely something that I highly recommend, and I was really happy and grateful to have had the opportunity to go down and actually see that as well. And then the day carried on with me going to the outpatient department and seeing what they do over there. So when I went to the outpatient department, the first thing that I actually did was observe a colposcopy. This is when a lot of the time ladies have had a smear test, and maybe their GP has referred them just because there's something that showed up in the smear test, just to ensure that it's nothing else. So they have like a dye inserted, just to rule out any other forms of any forms of infection, etc. So yeah, that was interesting, and it was nurse led as well, which I liked. So with the colposcopy, it's done just outside the room, and if following the dye results, if there's like anything that the nurse specialist thinks may be something, they take a quick biopsy just so that they can rule anything out, and it's sent to the lab as well. In the afternoon, I went to the clinic again to watch a hysteroscopy. So that is when this is with a nurse and a doctor. So the doctor does a hysteroscopy, and the nurse is basically the chaperone. So it's usually when it's very similar I think it's similar from my day being there to the colposcopy, but the only difference is that with the hysteroscopy, it's actually done inside the room. So the doctor has a look inside, cleans out, looks inside the room with a camera, and the colposcopy as well is looking just outside the room, but it's also with a camera. And with the hysteroscopy, it's just like the colposcopy. If the doctor thinks that anything may be abnormal, then they take a biopsy just to ensure and rule out anything and send it off to labs just in case. And with the clinic, it is 9 to 5 as well. Out of my 2 days, I think I enjoyed most the emergency gynecology unit, only because it kind of feels like that's something that I would like to do. Like, it's kind of like my style of nursing, in the sense where, like, I don't know, I just feel like I just really enjoyed it. I feel like I learned so much just being there. But I also really, really liked the gynecology oncology meeting. I felt like it was so interesting. And I feel like the work that those nurse specialists, the gynae onc nurse specialists do, is really, really incredible as well. So yeah, this video is just to give you guys a heads up. Like, you can ask to do different things in your department. Don't feel like you have to carry on doing the same thing day in and day out, especially when you want to keep your mind open on learning opportunities as well. So I hope you guys enjoyed this video. I will see you guys next week, so please do subscribe, like, and share this page with friends. And yeah, next week we're going to be doing a vlog, so keep your eyes peeled for that. And I think the week after that we'll be doing a holiday vlog. Yeah, so keep watching, watch this space. I have amazing and fun news for you guys, but I need you guys to be watching for me to eventually tell you guys what it is. That's the deal. But yeah, bye guys.